Hello, everyone. Hello, hello. Happy Wednesday. My name is Jennifer Waters, and it's been a long time since I have been with you all here on Facebook and Instagram, and I apologize for that it's been, it just seems every Wednesday is busier than the last, but not anymore. I'm recording this, so it's actually Tuesday, so that I don't miss our time together tomorrow. And I want to talk about red light therapy for a couple of reasons. One, it's will benefit you to know about this modality. Two, it's becoming extremely popular. And three, there was some impressive studies done last year in 2024. I wanted to see some of the new research that's on PubMed and the NIH website in terms of red light therapy and fertility. And there were quite a few that are offering some very promising results for those of you looking to enhance your endocrine function, work on your thyroid, prevent miscarriage, improve your cellular health. I mean, these are all things that light therapy are known to do. So, first of all, I want to let you know this layout is a little weird today. I apologize for that. I'm not really sure how to change the background. And I was looking for one of my own pictures that shows the using red light therapy mask and how you can simply place it right over your neck, which is where your thyroid gland is located. Most of you know that already. But I also want to point out the fact that you can place these pads on the back of your neck also, and that will affect your thyroid. Why? Because the nerve roots at the C7, cervical spine 7, have the cranial nerves that are affecting your thyroid gland. So if you don't want to put the pad on the anterior part of your neck, you can put it on the posterior part, the back. Both are beneficial. So the thyroid gland is the most easy to access, regardless of your size, right? So I get a lot of questions about using light therapy over your abdomen for ovarian function, to improve follicle development, to prepare for retrieval, all of that. And it really can depend on how much abdominal fascia, fat, adipose tissue you have. We cannot guarantee that we can access your ovaries, right? But we can pretty much guarantee that we have access to your thyroid gland, because no matter your body size, your thyroid remains the most superficial of all the endocrine glands. It is by far the easiest to access, even though I often talk about accessing the hypothalamus and pituitary through the optic nerve, which is great, but you're not always going to have access to that kind of light system. Some of them don't offer that feature. So, accessing the thyroid gland using red light is a definite no-brainer. Yes, you can do it. Yes, it's going to benefit you. So you can see in this slide, this is my daughter. She's now 20 years old. This was when she was little, and she would be my model whenever I asked her to. She was a good little model. And that's not why I wasn't necessarily supporting her thyroid at that age, but I was just showing different locations of where you can put these amazing pads. So people ask me all the time, well, my thyroid is underactive. Will light therapy help? My thyroid I have a nodule. Will light therapy help? I have Hashimoto's thyroiditis. Will light therapy help? So here's the thing. All I can technically say is that light brings the body back to balance. The unit that we work with, CNY Fertility works with, is called in-light therapy. And you can read about it on my website, jenniferwaters.net, which I'll put in the chat if I can figure out where to do that. And you can watch a very nice video that was done for us by Dr. Kiltz, which is really cool. And this kind of the science behind it. So this system is FDA cleared for two things. One, decreasing pain and increasing circulation. And that pretty much covers a lot of issues that we are going to be talking about, including an under or overactive thyroid. All right. So here's the thing I want you to know, to remember. So light therapy, there's a lot of different names for it. Red light therapy, photobiomodulation, low level light therapy, low level laser therapy. There's all of these different names. So it's a little bit confusing, but they all mean the same thing. They all mean that light is coming from a source. In this case, it's a pad-based system. And these pads are going to be placed on your body, and it's going to donate light frequencies to your body, which then gets the body to heal itself. That's it, folks. It is that simple. Now, what happens, you can do a very deep dive into what's happening on the cellular level, how the red blood and endothelial cells are releasing nitric oxide, which is the miracle molecule. That's what acts as a vasodilator. That's also been known to be antibacterial. It is part of how I think of getting the body to heal itself in the terrain theory realm, which is what I'm part of. How do we strengthen you as the host of you? How do we get you stronger? How do we increase your light capacity so that everything that you're doing is going to work better? Now, how does that happen? That happens because actually how this miracle molecule gets released from the red blood and endothelial cells is by freeing it from the mitochondria. So it can get a little stuck in there because of all of the above, all of these lifestyle factors and things allow this molecule to kind of get jammed up in the cell. So when you apply light, suddenly it's released, and now it's doing what it was designed to do, which is all of these things we talked about: photobiomodulation, light stimulating your biology. So now whatever medication you're taking is going to work better. Whatever supplements you're taking, they're going to be more easily absorbed. Remember, we're bypassing the gut. We are shining light directly onto the skin, and it's going directly into your cells, into your organs, into your glands, right? So that is what is cool. So no matter what is going on with your thyroid, when you shine light directly on it, it is going to begin self-healing. That's it. So if you're taking protein-bound iodine to get the thyroid to work better, it's going to enhance how the thyroid is absorbing those nutrients so it can work better. If you're taking a pharmaceutical medication for your thyroid to get it to function, then it's going to, like I said, free up the nitric oxide in the mitochondria so that this is now absorbing better. Everything works better. So that's pretty much it in a nutshell. I highly recommend it. You can Google search your zip code and see who's offering light therapy in your area. You can find possibly somebody that could rent you a system if you wanted to work on it. Let's say you wanted to take the rest of this month of February and say, you know, I really want to focus on my thyroid because it's borderline, it's a little sluggish. I don't want to go on medication. I'd like to optimize its function before my next retrieval, before my next transfer, before my IUI, whatever phase you're in. You know, the thyroid is pretty much the central gland in your hormonal feedback loop. Everybody knows that. It's pretty much, I cannot believe the symptoms that are related to an over or underactive thyroid. The list is endless. And I think as we evolve in endocrinology, we're finding out more and more. What is not well known is how to feed your endocrine system so that it simply starts repairing. And you can actually, if you go to my website, jenniferwaters.net, under free resources, I've got some cool PDFs there for you to look at. What I've learned in my education through my wonderful teachers is that when you supply your glands with the nutrients in the forms of minerals and vitamins that they need, it can be quite immediate. The repairing aspect, the self-healing aspect of the endocrine system can be amazing. What you can do just by supplying it with the whole food vitamin and mineral complexes. And then when you, again, apply light to the area, it's impressive, the results. Remember, folks, we are designed to heal. We are designed to repair. Now, if you happen to be in the autoimmune phase of your thyroid, like Hashimoto's thyroiditis, that's a slightly different approach. I would still absolutely use red light therapy to support that, whether it be in the anterior or posterior. I want you to think about autoimmune as a phase, not as a standalone disease. The inflammation is a response. It is not a cause. Inflammation does not cause anything. It is responding to what's going on in your body, right? Think about, you sprain your ankle, inflammation shows up to the rescue so that the body can heal itself. So I want you to think of this inflammatory response as your body saying, wow, I need some healing here. So could you possibly give me some of the nutrients that I need so that I can stop creating inflammation so that your organs, tissues, and glands, bones can heal? So we have a specialized protocol for the autoimmune phase so that the body does not attack you. That's not what your body is going to ever do. The body does not attack itself, folks, unless you seriously have some psycho-emotional issues. But even then, the body is infinitely wise. Pregnancy is the perfect example of that, because we all tend to overthink everything, right? So we're thinking all of the time. Pregnancy, the gestational period, is a perfect example of how your body knows what to do without your mind. If your mind was actually in charge of growing a baby, imagine what could happen. Body knows what to do. You don't have to overthink it, folks. You don't have to overthink it, but you do have to feel how the body can heal itself. And if that's not occurring, then I want you to look at why. There's something that's missing. So if you're heading down a path of not healing yourself, then we need to do a deeper dive into causation. That's my favorite thing to talk about. And it's not rocket science. There's only a handful of things that cause problems, whether it's toxins, heavy metals, bacteria, viruses, stuck emotions, right? Intergenerational trauma, or structural issues. That's it. Vitamin, mineral deficiencies, right? There's those things. So that's it, folks. There's nothing outside of that. I can 1,000% guarantee it. So you can be a little bit creative in how you're thinking about it when you're thinking about causation and removing the inhibitions and applying the cure. And no matter what you have going on, applying light is going to assist you in that journey. So I just turned on the InLight system that I have here at home, and it's the one that we use at CNY Fertility, and it's the one that I use in my clinic all of the time. So I want you to work. Every location should have, I believe, if not right now, then that is certainly the goal, to have an InLight system available for everybody at all the locations. So you can consider this an adjunct to your acupuncture treatment. It can happen simultaneously with acupuncture. It could also be a standalone. Some people want to come in just for light therapy. When would this be most indicated? Well, leading up to a retrieval, it would be highly indicated. There's a large benefit for that. We have to be careful if you have PCOS. However, we're going to do a slightly different protocol for you if you have PCOS. My favorite time to do light therapy is between retrieval and transfer. If you're doing a fresh transfer, it's very important to get the body healed. It's major surgery. So you want to get your ovaries back into their optimal functioning and position after a retrieval so that they can start doing their job for you right away. We want them to start producing the hormones that you need to sustain a pregnancy. So even after transfer, a lot of people ask me, can I do light therapy after the transfer? Yes, you can, just not on the lower abdomen, even though I personally believe it would help facilitate implantation. We don't. That would be contraindicated. Where else can you put the pads post-transfer? Anywhere. Over the eyes, thyroid, thymus, low back, adrenals, behind the knees. You cannot do it wrong. I just don't want you putting it over your uterus. That's all. What else? What else? I had some questions I wanted to answer. So, sometimes we need to detoxify the thyroid because of the things, the thyroid tissue, I believe in my observations, is very sensitive. And so I think that's part of why the viral component, generally Epstein-Barr, is often the cause of Hashimoto's. And why does it tend to gather in the thyroid tissue? That is something we'd have to do a little bit deeper dive. And it may not, it may be in all of the tissues. It just presents in the body. It's the most easy to diagnose when the thyroid is under or overactive. So if you do know that you have a viral component, like Epstein-Barr or something else that's affecting how your thyroid functions, and you need to do a little bit of detox on it. So the cool thing about light therapy is that it's naturally detoxifying. It's helping to purify the glands and the tissue underneath it. So simply by shining light directly over your neck, you're already getting the thyroid to detoxify through this release of nitric oxide. That's how it happens. So then when you add in a couple other components that help to pull things out of the body and clean up the terrain, when you supply the nutrients, which is protein-bound iodine, that the thyroid needs to start functioning better, you'll be amazed at how quickly things can improve. So it's one of the things that I love to think about and discuss. It's set on a 20-minute timer, so 20 minutes is all you need per session. You can do that a couple times a day. And what else? I wish that this were live so I could answer any of your questions. But anyways, I can't put my website on here. So just reach out to me directly via jenniferwaters.net with any questions you have, and I promise to answer them. All right, everybody. Thank you for your interest in light, and keep it light. And I look forward to seeing you in the Syracuse office whenever you happen to be here in lovely, chilly Central New York.